Chapter 7 is going over the skeletal system. So, first, to just kind of give a little bit of an intro. Again, coming from Greek and Latin, we derive a lot of our different words for anatomy and physiology, skeleton being one of them, which means a dried framework. And the skeleton really is the framework of the body. It is weight bearing, it allows us to move our muscles and do activities. It is protection for a lot of our internal organs. And it has some additional things as well, which we can see here, and we'll look at their functions. It helps with blood cell production. It stores inorganic salts, and it helps spare the weight and allow movement, like we mentioned. Just like we learned for the two divisions of the body, there are two divisions of the skeleton, the axial skeleton and appendicular skeleton, which I'll want you to know the bones that kind of exist in that arena. So first, let's go through some different bone shapes before we get into the axial versus appendicular skeleton. So as far as our bone shapes go, there's kind of four categories that we put them in. A lot of the bones in our arms and legs are termed long bones. They are long and narrow. You can see an example right here. Okay, this is the humerus in the upper arm. And so typically they have like a narrow shaft here, and then the ends are expanded with the head and then the end of the bone. Those are long bones typically found in the arms and legs. Short bones are tiny bones. They are often cube-like, where their length and width are equal. And you can find these in a lot of areas. So this is an example here for the wrist, okay? These small bones that make up your wrist bones, also called your carpals, as well as some of the small bones that make up your ankle or your tarsal bones. Those are short bones. They're small and cube-like, and they work together to perform the actions that they do. Third category is flat bones. We can see them in certain parts of the body, but characteristically, we see them in the skull. So these are plate-like with broad surfaces. You can see part of the skull cap here, okay? Another bone like this might be like the sternum. It's flat and has a very broad surface, flat bones. All of the other bones, if they don't fall into these first three categories, are classified as irregular bones based on their irregular shape. And most of them are used to connect to other bones. A good example here is your vertebrae, okay, and your back and your spine. And those aren't any kind of characteristic shape that fall into the other categories. And so we would term these irregular bones. There's a lot of bones in the body that don't follow these kind of rules for classification. And so if they're an odd shape, we just term them irregular bones. Not only can we classify bones by shape, we can classify them by type. Um, these are what kind of make up bone. So both of these types of bone exist, okay, in making up the structure of our bones. The outer portion of our bone is termed compact bone. It is made of these cylindrical units, which you can kind of see here look like tree stumps, okay? They're called osteons, and a bunch of them together make up this compact bone. This is super strong and solid, making your bone very protective and hard. And this is often where we're going to see that storage of those inorganic salts, making your bone very tough. Inside the bone, you can see this sponge-like material. This is called spongy bone. Okay. It's also called trabecular bone because all of these little branching plates creating that kind of porous structure are called trabeculae. So spongy bone or trabecular bone, these are more lightweight, and they are filled with holes because bone marrow is going to be inside of these. It has a little bit of flexibility, and typically, where we will find it is in the epiphyses or the expanded ends of long bones and in flat bones. You can see this example of the skull here, where we have compact bone on the outside, and then we have that spongy bone on the inside. So, for some of the functions of bones, and I think we pretty much know this first slide probably fairly well, they support and provide protection. They aid in movement, so they help us move our muscles, which we'll be learning about muscles in the other chapter. Blood cell formation is something you may or may not be familiar with for a function of bones. The process of blood cell formation is a fancy word called hematopoiesis. Hemato means blood, poiesis is the formation of. So hematopoiesis is just general blood cell formation. It makes our red blood cells, white blood cells, our platelets, and part of our blood plasma. So hematopoiesis, blood cell formation. This happens inside the bone, and the tissue that accomplishes this is your bone marrow. There are two different types of bone marrow, and remember, bone marrow is existing in that spongy bone. And red bone marrow is the active one that actually does hematopoiesis. We have quite a bit of red bone marrow when we are children, right? Trying to form as much blood cells and things that we need, okay? But eventually, as we age, it turns into yellow bone marrow. So we have a couple places in the body as adults that still carry red bone marrow for the formation of blood cells. But a lot of it, as we become adults, gets replaced by fat tissue, adipose, and this will become yellow marrow based on that fat content. Another function of bones is inorganic salt storage. The biggest inorganic salts that we see is calcium phosphate, although there are other things that are also stored, but calcium phosphate is the one that we focus on. And calcium phosphate gives bone a decent density. And so when we do start to look at the loss of bone density, which can often be seen in women as they age. And a really, strong form of this is the kind of progression of osteoporosis, where there is a significant loss of bone mineralization. And usually that main mineral is calcium phosphate that's being lost. Um, this osteoporosis could have a genetic component for sure, but in addition to that, it's heavily regulated by hormone levels, and there are certain hormones in the body, specifically PTH, parathyroid hormone, and calcitonin, which regulate your blood calcium levels. If you have high levels of calcium in your blood, that means it's not in your bones, okay? And parathyroid hormone, PTH, is what's going to increase blood calcium levels. If you have low blood calcium, this means that we're using a lot of that calcium to build bone, and calcitonin is produced, and that causes an overall lowering of blood calcium levels. Both of these hormones work together, even though they are antagonists, so that they can regulate your blood calcium levels so that we are effectively remodeling our skeleton every year. For bone development, because I did just mention skeletal remodeling as adults, depending on how much we use those bones and how active we are and what kind of injuries we might cause to our bones, we remodel our skeleton about 20%, okay, of that skeleton every year. But when we are in fetal development and we first start growing our bones, there are two ways that we do this. And kind of our bones that we form are termed intramembranous bones and endochondral bones during bone development. Intramembranous, these bones come from a membrane base, and endochondral bones come from a cartilage base. And we know examples of each of those. So, kind of looking at this here, the process of forming bone is just called ossification, just a fancy word there. So, if we are forming largely what we're going to term our axial skeleton, okay, the bones that exist within the head, neck, and trunk, okay, though a lot of those actually come from membranes or connective tissue for intramembranous ossification. So, skull bones, your clavicles, also called your collarbones, sternum, and some of your facial bones, these all come from connective tissue and they are formed through intramembranous ossification. Now, the bones of your arms and legs and the rest of your skeleton, those come from a cartilage base, specifically hyaline cartilage, which is the most common cartilage in your body. It is very structurally sound, and those bones coming from this cartilage base are coming from endochondral ossification. This is just an example of this. The only reason why I give this example, you don't have to memorize each of these steps, is to highlight the word epiphyseal plate. Okay. Epiphyseal plate is the same thing as your growth plate, and your growth plate is made of hyaline cartilage, the same hyaline cartilage that is used to make your bones, right, through endochondral ossification. And so, as you age, and when you're a child, if you've ever had x-rays done, you can actually see that cartilage on the ends of long bones, and that's part of your growth plate, your epiphyseal plate. And eventually, this will kind of disappear as you reach adulthood. But epiphyseal plate is the key word here, something you may need to know for the quiz. That is just your growth plate where hyaline cartilage is involved through that process of endochondral ossification, making bones. Here's just an example of this where it's kind of highlighted lighter, where you can see just those areas where we have those growth plates, that hyaline cartilage. As far as our skeletal organization goes, and I do want to get into this a little bit, you do need to know not every specific bone per se, but you do need to know what groups of bones are classified for each skeleton. So, firstly, you need to know that there are 206 bones in the adult skeleton. Some people have extra bones, but for our definition, there are 206 bones in the adult human body. And those bones in the skeleton are separated into axial versus appendicular. Now we remember this from the first chapter. Axial is the head, neck, and trunk. So we're going to focus on bones in the head, neck, and trunk for axial skeleton. And then for appendicular, this is the arms and legs. So we're going to focus on bones there. So in the axial skeleton, which is about 80 bones, you have your skull bones, your middle ear bones, your hyoid bone, which is found in the neck, your vertebral column, right, what protects your spinal cord, and your thoracic cage. Your thoracic cage includes your sternum and your ribs. So this is all in the head, neck, and trunk region, axial skeleton. Appendicular skeleton is part of the arms and legs. You have your pectoral girdle, which is your shoulder area, those bones in your shoulder. You have your upper limbs, so your arm bones. You have your pelvic girdle, so these are your hip bones, okay? And then you have your lower limbs, which are your leg bones. Those all are encompassed in appendicular skeleton. Again, pectoral referring to the shoulders, pelvic referring to the pelvis. And again, we just have some additional explanations here that you can study as you create your own guides, okay? Skull contains your cranium bones, okay, and your facial bones. Cranial bones are just the skull bones. Facial bones are what's on your face, right? Hyoid bone in the neck, okay, I gave a picture here. If you ever follow case files, forensic evidence, right? If someone has been suffocated or choked, typically the hyoid bone may be broken. Okay, it's sitting right in the neck there. Vertebral column, made up of your vertebrae, right? Protecting your spine. And then your thoracic cage is your ribs and your sternum, okay? Protecting all those internal organs there. And just some pictures here showing these things, right? We've got a few different pictures here of different skull bones, facial bones, vertebral bones, right? As far as our vertebrae goes, it is separated into different sections. Cervical means neck. So our cervical vertebrae start in our neck. As we get to the bones that actually attach to your ribs, we have the thoracic vertebrae attaching to the ribs. Then in your lower back, you have your lumbar vertebrae. You might think about lumbar support, right? Support for your lower back. That's where your lumbar vertebrae are. And then getting down to the bottom here, we have some fused vertebrae, your sacrum, which is this larger bone here, and then your coccyx, which is your tailbone, this smaller piece here. These are what make up your vertebral column. So we have cervical, thoracic, lumbar, sacrum, and coccyx. For your ribs, you have 12 pairs of them. This is the same for men and women. You have what we call different segregations of ribs. We have true ribs and false ribs. And hopefully I left the picture in. Yep. So your first 7 ribs here, and you can see kind of a direct connection to the sternum here for the first 7. Your first 7 ribs are called true ribs, and they are the ones that directly connect with this cartilage. It's hyaline cartilage to the sternum, which is right here. And then your other ribs, 8 through 12, these are considered false ribs. They just don't directly connect to the sternum. And these last 2 have no cartilage connection whatsoever. They are still considered false ribs, but because they have no cartilage whatsoever, we also call them floating ribs because they are floating in your rib cage area. For the appendicular skeleton, again, this contains the shoulder region. Those bones are the clavicle, your collarbone, and the scapula, your shoulder bone. Your upper limbs for your arms are the humerus, radius, and ulna. Your carpals are your wrist bones, metacarpals are hand bones, and phalanges are fingers. Your pelvic girdle, this is your pelvis, this is two hip bones, and we will find out that your hip bones are actually made of three bones fused together. And then your lower limbs, you have your femur, upper leg bone, your patella, kneecap, tibia and fibula, lower leg bones. Your tarsals are your ankle bones, metatarsals, foot bones, and phalanges, which are your toes, part of the appendicular skeleton. For the pectoral girdle, your shoulder girdle, this is consistent of your clavicle, okay? And we can see your clavicle does attach to the sternum as well, your collarbones. Your scapulae, okay, shoulder blades, okay, and scapula would be single. Scapulae is two of them because you have one on each side. That is your pectoral girdle, part of the appendicular skeleton. You then have some of your other bones, okay? So we have the humerus here. This is that upper arm bone. And then when we get to the lower arm, we have the radius and the ulna. Carpals make up the wrist bones, metacarpals, the hand bones, phalanges, the fingers. When we move to the pelvic girdle, we have two coxal bones. These are called the os coxae, if you see them, okay? And you can see here we have the sacrum and the coccyx in between your hip bones. Your hip bones are actually made up of three different bones fused together. And these are those. So the big one here, making these large wings, is called ilium. The one that makes this curve going outward, lateral, is called ischium. And then the ones that connect together in the middle, most medial, are called pubis. And you can kind of see in these pictures here how they connect together. Ilium, ischium, pubis. There are differences between the male and female skeleton, obviously, because the female pelvis is taking part as the birth canal as well. Typically, if you do find pelvis bones, you can tell whether they are male or female by a few features. The ilium, okay, which is these kind of wide wings, they're more flared in the female versus being a little more narrow in the male. This would make a woman's hips more broad than most males. The pelvic cavity, this area here, is a lot wider. And the pubic arch, which is right here, typically has a greater angle, more open, wide. You can see this a little bit differently with the male, where it's a little more narrow, both of these structures. Typically, as well, with if you're using real bones eventually in some of your classes, by weight, the male pelvis is typically heavier. As far as lower limbs go, okay, these are all the bones consistent for the lower limbs. We have the femur, okay, your thigh bone here. This is the longest bone in the body. And typically, where we see this patellar surface on the front, we would have our kneecap, okay, going here. Going lower in the leg, you have your shin bone, your tibia, and then you have your fibula on the outside. The tibia, this bigger one here, your shin bone, this is very weight bearing for most of your leg. The fibula is not weight bearing, but it does have attachment places for a lot of different muscles. For the foot, your ankle bones are referred to as your tarsals. Two of the major ones, talus, which is what the tibia and fibula articulate with as a joint, and then calcaneus is your heel bone, which supports the weight of your body. You have metatarsals, which are your foot bones, and then you have your toes, which are your phalanges. You can kind of see a picture here of that. I'm not going to make you memorize these, but you should be aware of these two large tarsals here, calcaneus, your heel, and talus, which is articulating with tibia and fibula. As far as joints go, we'll get a little bit into that. Joints are termed articulation. So when I say that these bones articulate with each other, they have a joint that allows them to move across each other. We can classify joints three ways functionally, whether they move or not. If there is no movement at a joint, which we're going to see some examples of this, it's termed synarthrotic. Synarthrotic, not movable. If there is some slight movement in our joints, we term it amphiarthrotic. And if our joints are freely movable, which we're going to see some examples of those as well, we term them diarthrotic. Not only do we classify by movement, we also classify by type. So there are three types of joints: fibrous, cartilaginous, and synovial, which we're going to get into those categories now. For fibrous joints, they typically hold bones together into close contact using dense connective tissue. Fibrous joints, for the most part, are immovable, meaning that they are synarthrotic, but there is one example where they are slightly movable. So the ones that don't move, okay, for a fibrous joint, this one is termed a suture, right? We have sutures between our skull bones that keep them together. We know that when we're born, we have fontanelles or soft spots. That's because these sutures, these fibrous joints, have not fully formed yet until we're older. And so these sutures are an example of fibrous joints, and they are synarthrotic. They do not move. Once this joint is in place, our skull bones do not move. I was going to give the example here for the other one. Let me go back. For one that is slightly movable, which we would term amphiarthrotic, this type of joint, this type of fibrous joint is between the tibia and the fibula, or the radius and the ulna, allowing slight movement between these bones. For cartilaginous joints, they're called cartilaginous because they're made of cartilage, either hyaline cartilage, remember, that's our most common cartilage, very structurally sound, or they could be made of a different type of cartilage called fibrocartilage, which is a shock absorber. Some examples we have here. So your intervertebral discs, right? You have cartilage in between the vertebrae in your back. Those are made of fibrocartilage and they absorb shock, right? So if when you jump up and down, your vertebrae don't clash into each other. These are termed slightly movable, which again, you should know that term is amphiarthrotic. And then a few other examples. You have cartilage, as we saw in that example, between your ribs and your sternum, connecting them together. That's hyaline cartilage, very structurally sound. And then another example is your pubic symphysis. Your pubic symphysis is a group of cartilage in between your pubic bones, and that is shock absorbing as well, and that's made of fibrocartilage. The last type of joint are synovial joints. Those are the ones that we typically think about when we think of arthritis, right? Joint pain is that pain in those synovial joints. All synovial joints are diarthrotic. They allow free movement. And we are going to learn some types of movement associated with that, which will be the main point of this joint chapter. Um, Typically, synovial joints are complex because they have a joint capsule that is surrounded by cartilage, as well as it's lined with the synovial membrane and it's filled with synovial fluid so that it lubricates and reduces friction created between the bones in that joint. Also, additionally, you might have menisci or a singular meniscus or bursae present there that allow that joint to move and provide shock absorption. Let's see if we got a picture here. So this is a typical joint that we might see. So here we have a ligament on the outside. Ligaments connect bones to bones. And then we have a synovial membrane lining this joint area filled with fluid so that these joints can be diarthrotic, freely movable. And remember, all synovial joints are diarthrotic. Here's a really good example here with the knee, okay? We have our knee bone here, the patella, we have our femur, we have our tibia, and again, we see this nice joint capsule around it, and even, especially in the area of the knees, we have some shock absorbing things like bursa or menisci present to help with that shock absorption in that area. The types of synovial joints we have can be named. We have ball and socket ones. Think about ball and socket. You can think about the ones in your shoulders, how your humerus attaches to your scapula. You can think of how your femur attaches to your hip bones. Ball and socket. Condylar is another one. Condylar typically we see with the fingers and the hand bones, those joints between them, and they have kind of a back and forth type of movement. Plane or gliding joints, we can see this in some of your carpals and tarsals. We can see this between the vertebrae. Hinge joint, you might think of with your elbow or your knee, forming kind of like a door hinge, going back and forth. I'm going through these quickly because you don't have to memorize these types of synovial joints, but we do need to know their types of movements, which we're getting to in just a second. The last type of synovial joints are pivot. We can do pivot with our head between our two top vertebrae, axis and atlas, right, for pivoting our head. And then we have a saddle joint. One of the best examples is between our thumb and our hand bones, but we do have a few other examples as well. You can see some examples here that might help it a little bit. But what I really want to get to, and this is what you're mostly going to be tested on for your quiz, is the types of joint movements. So typically, and when we get into muscle, we'll learn this a little bit more. You have different parts of muscles that attach to different bones, and the points where they attach create what we call insertions and origins, where those muscles attach to bones. An origin is a place on a bone where the muscle doesn't move, and the insertion is the other attachment point of that muscle, where if we move that bone, we move that muscle. So we're going to get into that a little bit in the next chapter. Some of our main joint movements, and I'm sorry, we're going to go through a few of them, so I would definitely make flashcards for these, maybe even print the pictures and make flashcards. We have flexion and extension first. Flexion and extension, you can think about flexing your biceps or extending your arm. So flexion and extension have to do with the angle. For flexion, again, we can think of when you flex your bicep, you are decreasing the angle between your lower arm, your forearm bones, and your upper arm bone, that humerus. And so we've got flexion decreases the angle between the two parts of the joint, and extension increases that angle between two parts of the joint. We'll show pictures with this, I promise. Lateral flexion involves the whole body, typically. So when you bend over your head, neck, and trunk to one side of the body, lateral flexion. Hyperextension is going beyond normal anatomical position during an extension. We have abduction and adduction. Abduction, I like to think of that B as by, like see you later. Abduction is when you move a body part away from the midline, by. Adduction is when you move it towards the midline. I like to think of adduction as adding that part back towards the midline. We can see some examples of this. Abduction is moving the leg away. Adduction is moving the leg back. And this is all based on a point of reference, which is the midline of the body. Lateral flexion here, you can see she's decreasing the angle between the upper part of her body and the lower part. And then we have the actual true flexion and extension. Flexing at my knee joint here, which is a hinge joint, a synovial diarthrotic joint. Flexion, you are decreasing the angle between two parts of the joint versus extension, which is increasing the angle between two parts of the joint. A few other terms, and we'll see pictures. You can do flexion and extension in the foot, which we would term dorsiflexion and plantar flexion. Dorsiflexion means that you bring the foot closer to the shin. So that is a true flex, like when you flex your feet, dorsiflexion. And then when you point your toes, kind of bending your foot downward, that's called plantar flexion. Plantar means the bottom of the foot, so the bottom of the foot goes kind of towards the back of the shin, pointing the toes. Some other types of joint movements are rotation, circumduction, making circles, pronation or supination. To be prone, right, we have our palms downward. Supine is when we put our palms upward. And we'll see some examples of this. Okay, so here's dorsi and plantar flexion, flexing or pointing your foot. Circumduction, making circles. Medial rotation and lateral rotation. Medial meaning towards the midline, lateral meaning away. To be supine, that's palms up. We could also say if we have a patient laying in a supine position, they're laying on their back, their belly is up. Pronation is when your palms are down. We often say if we are getting prepared to do a push-up, our hands are prone. A few other terms, we have inversion and eversion. Inversion, where the bottom of your foot, the sole of your foot is medial, okay, towards the inside of your body. Eversion, the bottom of your foot is facing lateral away. We could do protraction or retraction. Protraction, moving a body part forward. Retraction, moving it backward. And then we can even do some simplistic ones like elevation and depression. Elevation is to raise that body part. Depression is to lower it. We'll see a few pictures here. Here is inversion. Bottom of the foot is towards the midline of the body. Eversion, bottom of the foot is towards the outside, lateral. Protraction, the chin is moved forward. Retraction, it's moved back. And then we can see an example here with the shoulders. Elevation to raise the shoulders, depression to put them back down.